Friends, this is physiotherapist Dr. Shruti Parekh working in Advanced Knee and Shoulder Hospital run by renowned arthroscopic surgeon Dr. Prathmesh Jain in Ahmedabad, and we have with us Dr. Himanshu Patel. He is an orthopedic surgeon working with us. So today we will be discussing about plantar fasciitis, which is very commonly seen in these days, and that is in layman terms known as heel pain or sole pain or ankle pain. So these days people are experiencing heel pain a lot, and that seems to be the treatment seems to be really not working. So we'll be discussing about what are the specific treatments and what can patients really do, what are the causes and what are the investigations they should be doing. So first of all, let's know about what is plantar fasciitis.
The plantar fasciitis is a inflammation of the plantar fascia, which is the fascia connecting the calcaneus and the metatarsal and the proximal phalanges of the sole of the foot. Whenever there is an inflammation of the plantar fascia, it causes a severe pain on the sole of the foot, which causes the troublesome in walking and as well as jogging and sitting and climbing.
Okay, so the most common symptoms are
pain in the sole of the foot.
Experiencing
Yes.
pain in the sole of the foot, and while doing what specifically?
Specifically like walking, running, jogging. Whenever patient wake up in the morning and put the limb on the floor, the patient feels severe pain at the time.
Okay, whenever the foot is placed on the floor, patient experiences pain, and that is most commonly seen early morning,
Yes.
right? Okay, what are the causes?
There are the different causes of the plantar fascia. One of the most common causes is the blunt trauma to the sole of the foot. Second one is the calcaneus spur. Then there is a newborn formation at the tip of the calcaneus,
Okay.
where the plantar fascia attaches.
Hmm.
So it causes a continuous irritation and the inflammation of the plantar fascia. Other causes are like patients having long-standing rheumatoid arthritis or uric acid.
Hmm.
There will also the inflammation of the plantar fascia.
Hmm.
Also, in some patients of diabetes and thyroid, they also develop the plantar fasciitis. Okay. In some cases, in some patients, we have seen the plantar fasciitis without any specific reason. Idiopathic. Those patients having long-standing walking or long-standing job on standing on the floor.
Professional hazard.
Yes.
Hmm.
They also develop the plantar fasciitis because of the continuous pressure and the continuous irritation of the plantar fasciitis because of that.
And overweight also can be one of the
Yeah,
reasons.
obesity, because obesity also correlated with the thyroid and the diabetes.
Hmm.
So the patients having the overweight, they also develop plantar fasciitis. But in that scenario, it is not necessary that all the patients having obesity or diabetes or thyroid or long-standing walking, they also develop the plantar fasciitis. We have seen the patients, thin patient, lean patients without the diabetes or thyroid, they also develop the plantar fasciitis.
Plantar fasciitis. All right. Okay, how can we investigate that we have got this plantar fasciitis?
There are only two investigations for the plantar fasciitis. One is the X-ray, in which we take the lateral X-ray of the foot. In some cases, we have seen the calcaneus spur, which I have explained earlier. That calcaneus spur develops in the anterior portion of the tip of the calcanea, and so it causes the continuous irritation. And the most common investigation is second one is MRI, in which we have seen the some specific signs like fluid signs or any hyperintensity or the attachment of the plantar fascia to the calcaneus. So we can easily diagnose the plantar fasciitis on MRI.
Okay. So calcaneal spurs are basically the new bone formation over the heel.
Yes.
Okay. That can be investigated by an X-ray.
X-ray and MRI.
Okay. And what are the treatment options, like for beginner level plantar fasciitis and for advanced level plantar fasciitis?
For the patient who develop the plantar fasciitis in initial stages like 1 month or 2 months, we have given them the conservative treatment, which includes the modification of the footwear. Like we have advising them the soft cushion footwear both in the inside and outside of the bone. Hot water and cold water fermentation alternately like 30 seconds for 5 minutes 3 times a day. Second one is the physiotherapy, the stretching exercise of the plantar fasciitis, like walking on the barefoot on sand and gripping the sand, stretching of the plantar fasciitis on standing, and third one is the curving exercise. And in some cases where the patient is having the pain for 6 months, 8 months or 1 year, and they don't want to go for the surgery, we are giving the steroid injection in the sole of the foot where the pain is severe, and the maximum dosage is about 3 doses we can give of steroid. Now after that, if the patient having the pain continuously, then we are giving advice for the surgery.
Okay. What are the types of surgery that can be advised?
There are two types of surgery for the plantar fasciitis. One is the open surgery, in which we make about 2 to 3 centimeter incision on the sole of the foot. We cut the middle half of the plantar fascia, not the complete one.
Okay.
And second one is the arthroscopic surgery, in which we are doing the same procedure arthroscopically, in which we are giving just 1 centimeter incision on both sides of the sole. So it is a minimally invasive surgery.
So it seems arthroscopic treatment is better than.
This is better because it is a less blood loss, early recovery, less pain, and minimal incision. One stitch on both sides of the sole.
Okay. Okay, friends. So we have discussed the treatment for acute phases, for subacute phases, and for chronic phases, as Dr. Himanshu Patel told us. For acute phases, you can just go for contrast bath and physiotherapy treatments, and you can be applying some pain relieving gels, and you can be taking painkillers. In the subacute phase, you can go for steroid injections, which should be again limited. And in the third phase, that is the chronic phase, you should go for surgical interventions. So for more queries, you can anytime contact us, and we hope to deliver this kind of information throughout our life. Thank you very much.